Bronchiectasis is a chronic condition affecting the lungs and without treatment can lead to respiratory or heart failure.
Today we're going to meet with the pulmonologist Dr. Frederic Seifer to learn about the common signs and symptoms and the importance of early diagnosis and treatment.
But first, let's meet Patty, who went undiagnosed for almost 30 years, and how an easy-to-use, effective therapy is helping her breathe better and live better. Take a look.
Take a look.
I've been married for 40 years. I'm married to the most amazing person, Rob, and he's easy to be married to. We have a great relationship. We have a lot of energy. We like to do a lot of things, but more so for me, my biggest thing is baking. And I love making bread. That has really become my pastime with having to be home a lot. More recently, between COVID, being sick, I find it to be very therapeutic when you're going through anything in life. Well, it's interesting as a child because you don't really know what's going on all the time. You just know sometimes there's things that don't feel right. The breathlessness, I would say, was my biggest thing. But as time went on, I get infections, a lot of coughing, that type of thing, shortness of breath, congestion. It just, to me, seemed like nobody really knew what it was. Nobody bothered to pursue it or to figure it out. So I think that's the hard part when you realize it could have been different. You could have done different things. You could have gotten help in some way.
Bronchiectasis is a condition in which the lungs' airways are abnormally stretched and scarred, often caused by an infection or other condition that injures the walls of the airways. Patients cannot effectively clear mucus, causing it to build up and bacteria to grow. As a result, patients can suffer from repeated serious lung infections.
So as a pulmonologist, when a patient is referred to me and they give me a history of recurring cough, chest congestion, and sputum production, which is the stuff that comes up when you cough, and that sputum is yellow or green, and then they see their primary care doctor, or they go to urgent care, or they go to the emergency room and they get put on multiple courses of antibiotics over a period of a year, I would go ahead and order a high-res CT scan and document the presence of bronchiectasis.
It is estimated that more than 640,000 people in the United States are being treated for bronchiectasis today, but experts believe many others go undiagnosed. People who have conditions that damage the lungs or increase the chance of lung infections are at risk for bronchiectasis. Conditions include COPD, asthma, pneumonia, chronic bronchitis, and cystic fibrosis.
Bronchiectasis significantly negatively impacts the quality of your life. So at the end of the day, a patient that has bronchiectasis and it's not been diagnosed and is not being effectively treated, they're not getting better and staying better. The bronchiectasis will progress and the lung function will take a hit.
Well, we had been to a lot of different doctors and we had kind of exhausted everything. I decided to go to New York to take control of my own wellness, and it's the most beautiful decision I ever made in my life. I finally got to the most amazing pulmonologist, and she played such a vital role in making the diagnosis, but also providing a treatment plan for me.
Although there is no cure for bronchiectasis, early detection and treatment can help patients have a better quality of life and prevent further lung damage.
So the overall goal in managing these patients is first, diagnose the disease that is the bronchiectasis. Second, get them effective therapy. Airway clearance devices is the foundation because they can create and do create sufficient shearing force to actually mobilize those secretions and get them out of these patients' lungs.
There are several types of airway clearance options that can help loosen and remove mucus, including manual chest physical therapy, handheld devices, and high-frequency chest wall oscillation.
So the VEST Airway Clearance System by Hillrom was the very first high-frequency chest wall oscillation device to get FDA clearance.
The VEST Airway Clearance System from Hillrom is designed for both children and adults who have a hard time effectively clearing excess mucus. During therapy, the garment inflates and deflates rapidly, applying gentle pressure to the chest wall. This works to loosen and thin mucus and to move it toward larger airways where it can be cleared by coughing or suctioning.
It was about 10 years ago that I started with the VEST Airway Clearance System from Hillrom. It's the most incredible thing in how it brings up all the secretions. And it really helps you with your breathing, and the benefits have been tremendous. It was pretty emotional actually at the time because I had been struggling so much with it that I was one with this thing. To really have the healthy lung hygiene, making sure that you're doing all these healthy things to keep everything at bay is crucial. A prescription is all you need, and I think that's the interesting part with this. Hillrom does the rest. They work with your insurance, and I'm grateful the fact that they go to bat. Hillrom sets you up for success. As your support in your network, they don't only just deliver merchandise, but they train you. They make sure that you know how to use it. If I need anything from them, I know that I can call, and they're so reliable in getting things done. And we're a team together.
What's really critically important in the management of patients is this open communication. It's fundamental. And the communication has to be between the patient and the provider, between the patient and the company that's providing them their equipment. And I have found that my years of working with Hillrom that they do support that patient and their needs, help support me. I look at them as a colleague, collaborating with me as a partner in the healthcare management of that patient. You are your best advocate for your own health. Don't let your provider make you feel that it is a burden to them to answer a question that you have. And when it comes to your health, you don't want to be passive. You want to be active. You want to be actively involved in your health care.
When you struggle and you find something that works and it's reliable and it's dependable, you want that. You want that as part of your treatment. And it's such a relationship now that I wouldn't be this successful. I would not be here without the VEST. And I've benefited so tremendously with this that I'm so much healthier and I live a better life.
If you have bronchiectasis, speak to your doctor to see if the VEST Airway Clearance System
from Hillrom is right for you.